satiety. No one reminded me. Satiety. See, my brain really works because I take my supplements. Satiety. How many people here don't get full? Don't get full. Don't feel satisfied until your stomach is really, really full. You have to kind of stuff yourself. And once you stuff yourself, I'm full. Okay? Nobody else? Liars. Because if you know, stomach acid, this is one of the wonderful things about stomach acid. This is why I love stomach acid, because I had bulimia when I was a teenager. So that means I would eat a half a loaf of bread, and then I would throw it up, and then I would eat another half a loaf of bread. Okay? Nobody talked about why the bread was disappearing. Nobody talked about why there were 3 or 4 candy wrappers in the trash can. We didn't talk about things like that. These are my wonderful parents. They were great at other things. They were both physicians. But that was back in the 50s and the 60s. We didn't talk about things like that. And I couldn't get full. I couldn't get satisfied unless I ate huge meals. That was because I didn't have enough stomach acid. One of the other wonderful things that stomach acid does for you is it tightens this sphincter here, it opens up this sphincter, it helps you digest and absorb the nutrients that you need here. It goes down into your small bowel, and the stomach acid going into your small bowel is basically what tells your pancreas, release the enzymes, the food is here, we need to complete digesting this food. That's part of what it does. If you do not have enough stomach acid, then you're not going to have good release of enzymes from your pancreas. So you're not going to digest your food very well. It also tells the pancreas, send a message up the brain. Tell the brain, I'm full. So anyone who is big, who is overweight, because you cannot get full, take some stomach acid at the beginning of your meal, and you will find that you get full much faster. Eat more slowly, there's other things involved, but you will be amazed at how quickly you get full, and you'll be satisfied, and you won't be hungry an hour, hour and a half from now. It'll last. So it's an incredibly powerful chemical, not chemical, but you have to have stomach acid for optimum health. Okay, let's go back to high blood pressure. Okay, one other thing about magnesium. If we are stressed out, you pee out more magnesium. Now that's really, really helpful. You know, if you have a tiger here, okay, and they're going to get ready to eat you, either you have to attack the tiger or you have to outrun the tiger. Okay? Dropping your magnesium down, you pee it out really quickly, shifting it in different places so that there's less magnesium, raises your blood pressure up acutely, okay? And it does lots of other things for you, but raises your blood pressure acutely so you can run. And so you're smart, you're bright, et cetera, et cetera. Okay? You can focus on everything you need to do. Lower that magnesium, kick in that sympathetic nervous system, okay? Magnesium kicks in the parasympathetic nervous system. You're calm, it's chill, just finish eating, maybe a little bit of sex, just take it easy, kick back. Not real helpful when you got the tiger right there. Okay? So drop your magnesium down when you were stressed out. There isn't a person in this room that isn't stressed out. With the amount of gizmos that we deal with how our lives are driven by schedules, by the numerous demands, by financial issues, by the poor quality of the food that we eat, by not having downtime. We're constantly going. Okay, all of those things make us pee out more magnesium, so our needs are greater. Okay, the food does not have as much magnesium in it as it used to. So that's partly why, it always used to be that you heard 70% of the population. 70% of the population is low on magnesium. Do you think that contributes to why people blow up and shoot other people inappropriately? Do you think that's part of why there is so much anger and so much violence? I think so. Just mainline a little bit of magnesium, calm down, chill out. But when you start replenishing magnesium, you have to spread it out, the same way you do the other nutrients. But you have a safety valve with magnesium. You cannot overdose on magnesium because your body will give you diarrhea first. And so if you take a lot of magnesium at one time, especially a very poorly absorbed magnesium, it's great for constipation, okay? So magnesium oxide that you can get at CVS, any place, magnesium oxide is one of the most poorly absorbed magnesiums out there. So you'll see it in the El Cheapo, like the calcium carbonate, calciums. It'll be calcium carbonate, magnesium oxide, and a little bit of zinc oxide. And magnesium oxide is there because the calcium, that calcium product, calcium carbonate, is the most poorly absorbed calcium. So it's very constipating. So you have to have the magnesium there so you still move your bowels. But you really don't absorb very much of either of them. So you only absorb about 10% at most of whatever you're taking. And you don't absorb any of the zinc because the zinc goes into the same doorway as calcium and magnesium, and the body always chooses to absorb calcium first, and then magnesium, and then zinc. Okay? So don't even consider that you're really absorbing that zinc. You're not. But magnesium oxide by itself, you can buy at the drugstore, and it is wonderful if you have terrible chronic problems with constipation, or if you have an episode of constipation. And you can take anywhere between, you have to kind of work with your body and see. You can start out taking 2 of them. If you don't move your bowels, take 3. If you don't move your bowels, 4, take 5, take 6. Nobody, I have 2 patients that had to go up to 9 pills. These are 400 milligram mag oxide. But most people will start moving their bowels at 6. And what happens is, you kind of, and what you're doing there is you're not loading your body's magnesium. You are loading the magnesium receptors just in your gut. And when you finally saturate all the receptors for magnesium in your gut, that's when you get diarrhea. So just keep on increasing it each night. And then when you get diarrhea, cut back by 1 pill. And that's probably going to be the pill that you need to stay on. I mean, I used to do that in nursing home patients all the time. Nurses hated me. They started pooping.
But are you saying that there's a better magnesium?
Yes, I'm saying that that magnesium is very helpful for chronic constipation.
Right.
So if I have a patient who has chronic constipation and also has high blood pressure, that person's going to be on 2 different magnesiums because I want to put them on the other magnesium that is very well absorbed. Now, the power of even the ionic magnesium that is in calm, okay, that's still going to go in through the calcium, magnesium, zinc doorway. Okay, so you don't really want to take it with calcium. All right. What we have on the other side, and what you can get other places, is a chelated magnesium. And a chelated magnesium means you've got magnesium here, and it's got a protein hooked onto it. Not a protein, it's got amino acid hooked onto it. So when I sell magnesium glycinate, magnesium malate, we sell one that's OptiMag, that's a couple of different ones. Mag citrate is not chelated, okay? It's associated with it, but it's not chelated, but it is better absorbed than the mag oxide, but it's still not well absorbed. So if you get a chelated magnesium, it doesn't go in through the magnesium doorway. It goes in through the amino acid doorway. But for it to be really chelated, I mean really hooked on this way, so it goes in, it gets pulled in through the amino acid doorway in your gut. It has to have the label Albion on it. Albion holds the patent for chelated minerals. So look for that. And there are other products out there besides mine that have Albion, okay, on it, but that's what you want. Some of the other products that are sold that say, I'm magglycinate. Well, they put in some glycine and they put in some magnesium and they say that it's magglycinate, and it is not. Now, if you get good results with it, then it's working for you. All right? But if you're not, trash the stuff and get something better. You can get better supplements here at my my Natural Vitality Center. The Synergy Health, which is owned by a certified clinical nutritionist on New Garden Road, and then Natural Alternatives, also on New Garden Road, that is owned by a pharmacist. All of us get access to a higher level of supplements. Now, am I saying that ours are better than Earth Fare or Deep Roots or Whole Foods or House of Health? Not necessarily, but ours will tend to be a bit more concentrated, okay? And most of the stuff at those other stores, you should be able to absorb them pretty well, and they shouldn't have any kind of toxins in them, okay? You know, if you go to Wally World, things like that, you don't know what you're getting. Okay, but again, back to hypertension. So if I have someone who has hypertension, magnesium is not the only thing that I give them. Okay, if you have high blood pressure, then I'm going to say, be careful with your salt. Okay, I will tell you, get on Celtic sea salt, because Celtic sea salt has lots of different, it's a wonderful source of magnesium, a wonderful source of lots of other minerals in it, and a lot of times the reason that you have the high blood pressure is because you are deficient in minerals. Most of the people that I see, the first time I see them, I test them for minerals, and they're all deficient in minerals. I mean, this is not a few odd ducks out there. It's us. It's us. So I'll have you use like Celtic sea salt, okay? And you can buy that. You can buy that lots of different places, and you just use that instead of regular salt. And then you'll have to take the magnesium probably at least 3 times a day. Okay? I would, you know, if you've got the Calm, then go ahead and try the Calm. Okay? And you know, you don't want to get crazy about monitoring your blood pressure all the time, but it might be fun to see what your blood pressure is right before you take the Calm. Wait about an hour, see what it comes down to. You'll probably see that it doesn't last. And it's not going to come down with one dose to where you want it. It has to build up in your system. When you do a magnesium RBC, it takes 3 months for it to build up. 3 months for the magnesium to build up. And if you go to your doctor's office and you ask for a magnesium RBC and they look at you kind of weird, okay, I would not use my name. I would say, I just heard about this on TV. Could you do this for me? Bat your eyelashes, women. Guys don't bat your eyelashes. And then what you want, they'll call you back and say, it's normal. And you can say, and I want to know exactly what my numbers are, please. And you want it to be at the upper range of normal. So the normal range for the local lab is 4 to 6.4. Okay? The optimal range is 6 to 6.4. I have only had 4 patients that were between 6 and 6.4. Everybody else, I had people down at 3.9, 3.8, 4.1, 4.2. I'm not making major changes in these people's lives by putting them on magnesium and using this tool instead of just a serum magnesium. A serum magnesium is a very poor reflection of what your body stores are, period, end of story. See, I've got a book that tells me
They don't work either.
they don't work either. Okay.
They don't work like hell, too.
Yeah, yeah. Well, Cozar, let's see what Cozar, or those kinds of drugs, deplete. I know they deplete zinc. The diuretics deplete zinc, potassium, and magnesium. Now, what do you think that's going to do with your blood pressure? It's going to tend to pull your blood pressure up. No depletions have been documented with this agent. Okay, so how about losartan and hydrochlorothiazide? CoQ10, magnesium, phosphorus, potassium, sodium, and zinc. So does someone who's on a diuretic, because all of that's coming from the diuretic, do they need to take all of that stuff? Yeah, they do. You're not going to get the right proportions in your food.
This was hydrozoline.
Hydrazolene.
It's not a diuretic, I don't think.
No, it's not. No, it's not. No, it's completely different. It's not used very often.
It's older, real older.
It is older. And I'm not going to tell you that because I want to go ahead and pick up some other ones. How about anybody on birth control pills? Not anymore. But did you have problems when you were on birth control pills? Did you get depressed and sit in a corner and cry like I did for a whole month? Or no, for a whole summer. Okay? Guess what birth control pills deplete you of? Folic acid, magnesium, tyrosine, which is the underlying amino acid that makes thyroid hormone. Okay? It's also the underlying amino acid that helps you make dopamine and norepinephrine and epinephrine. You can't burn fat. You can't lose weight if you don't have enough tyrosine. B2, B3, B6, B12, vitamin C, and zinc. Is it any surprise that some women get depressed or get fat on birth control pills? Yeah. Oh, let's go ahead and do next. Let's do shoot. What is the omeprazole? Omeprazole. Okay. Selenium, zinc, iron, calcium, magnesium, B12. But y'all knew that already. I told you that. Along with folic acid. So drugs do this. If you're on any drugs, and that's partly why we put that table in the magazine. So take a look at that and look at the things that you have a potential risk for. We can also do very fancy, elegant testing. And we do that. You don't have to be my patient. You can come in, stick out your arm, pay whatever we're charging you for it, and you can find out what you're deficient in. And the test includes CoQ10, alpha lipoic acid, which is a critically important antioxidant, and some of the other glutathione. So it's a very, very useful test. Okay, thyroid and hot flashes, 20 years. Okay. 22, okay. The only thing that you can do is I don't know, I'm not familiar with the product that you're on, okay? But there's red clover out there. There's kudzu. There's a special kind of kudzu that actually is being promoted now. It's called HRT Plus, but it's a very special kind of kudzu. Kudzu is used all over the Orient for treating addiction.
You mean what we don't have here, they got?
That's right, yeah. Yeah, but kudzu is used for treating addiction, for treating addiction to alcohol, to nicotine. It's also used as an estrogen. Okay, but evidently this particular kudzu in Thailand, according to Gary Gordon, is wonderful for menopausal symptoms. You can use black cohosh. No,
Didn't work.
no, did not work.
We sell a product by Metagenics called Estrovera that they do a money-back guarantee on their product. And it's only for hot flashes. That's the only thing that it does, regulate hot flashes.
Is that sold over the counter?
Yeah.
Yes,
I think that's where I tried it, it didn't help me
Well, it's
it's a specific company's
It's a-
patented
yeah. This is made by Metagenics.
herb.
Yeah, so that might be an option for you. But quite honestly, if you are still flashing and you've been doing it for 22 years, you need estrogen. Okay, you need some estrogen. Because the women who have hot flashes, and where the hot flash, you will continue to flash for the rest of your life. Okay, and that's not coming from your skin. That is your brain crying for estrogen. Okay, now women who are closer to menopause, sometimes the hot flashes will go away. Okay, but you will still have accelerated aging. You'll still get older faster.